Hey guys, thanks for bearing with me. I just got home from the clinic, seeing patients, the last of whom was a great example for tonight's topic. So I'm really excited to dive into this and see you guys. So welcome to another episode of SuperSoul Boulder. I'm your host, Dr. Lara Johnson from Yellow Brick Physical Therapy in Boulder, Colorado. And SuperSoul Boulder is all about mind, body, heart, health, and wellness. And why do I call it that? I was just thinking about this a little bit more this week, and I know a lot of people, well, I spent my career studying the body, right? Health and exercise science and physical therapy, so a lot of body. And then, you know, through things like yoga and other practices that go deeper, there's a mind-body connection. It's being very interested in the mind, but I think it's not just about a mind-body that's keeping something out. It's also about your heart and what it is you love to do. What makes you unique and special, and what allows you to, how your mind and body can allow your heart to live out, like, you know, all those three integrating allows you to live out your most true purpose in the world. So mind, body, heart, that's what we're about here. And thank you so much for hopping on and joining me tonight on another Monday night. And tonight's topic is about strength and flexibility. And like I said in the post description, strength includes flexibility, and flexibility includes strength. So there's an integration, just like I'm talking about the mind and body and heart. We need to separate them out to talk about them, but they're not really that separate, right? And we really need to integrate these, even in our minds conceptually, to really get the full strength of it, so to speak. So what do I mean about this? So strength includes flexibility. Well, let's look at the body first. A lot of people get these confused. So when you think of strength, we usually, hey Dan, great to see you. Thanks for hopping on. You're always so consistent. I love it. So when we think of strength, we think about, strength training, strength of your muscles, a hardness of your muscles. But if we strengthen without full lengthening of muscle, then it creates rigidness or rigidity. And I see this all the time with patients. And then unfortunately, a lot of times people will be directed to strengthen for a rigidness problem, even because they're not seeing it that way. And then they're feeding into that problem. So it's like, oh, I'm exercising a lot in order to keep myself healthy. I need to strengthen. Well, if you're exercising a lot and then you're using strengthening to support that, then you're doing a lot more of exercise. For instance, we'll talk about this more in a second, so hang with me here on this. And then in our lives, if we get so focused on strength and hardness, we can become rigid in our decision making too, right? Our ways we see the world, the way we take ourselves to be. How often do you feel like you might be getting rigid, although it may feel like strength in your life and the way you see things, how you see people, what your mind is open to, how it can develop or grow. And so our minds need flexibility in order to grow and develop and continue to take in new information and synthesize that and analyze that and find out what's true. And it takes strength in order to do that. Or another way to say that is that it takes courage. It takes courage in order to do that. So strength and flexibility, we need to think about as two things that can incorporate. So let me back up for a second. It's just like when I was in grad school getting my master's in exercise science, I taught this undergrad class called Health and Exercise Science 101, HES 101. Like Wake Forest HES department, props to you guys. But anyway, we would teach these lectures on strength, flexibility, and cardiovascular fitness. And so we piece that apart, right? Strength training to build muscle. We get muscle strength and hypertrophy, and that's right. And then flexibility allows it to expand. But a lot of times these concepts get compounded. And even my patient I just saw was asking me about, well, isn't like lengthening the muscle isn't the same as eccentric strengthening? And I said, no, because one, we can take concentric strengthening of a muscle, which is shortening and contracting, and then eccentric is lengthening and contracting, but both are contracting of muscle. So, and both are exercise. So we can take the concept of exercise and think of it as exercise is contraction of muscle. Running is repetitive contraction of muscle. Strength training is contraction of muscle for sure. Swimming is contraction of muscle. There's a lot of repetitive contraction of muscle happening. That's exercise. Exercise has that element to it, contracting a muscle. Whether it's shortening and lengthening, right? There's paired movement of lots of muscles too, to have fluidity in our motion. All that's good stuff. But then I want to challenge us to think of flexibility as the lengthening and relaxing of muscle. It's not just lengthening and contracting. That's still exercise. That's still contracting. We've got to lengthen and relax the muscle to actually balance and pair the strengthening. Okay, so if you're short and tight in some place, or you've got a pain or problem, like let's just take my patient who I just saw. So she had some significant pain, like a pain in her hip and abdomen region. That is, from my assessment, neurologically related, neuromuscularly related, but I wouldn't ever want to have her do core strengthening for that, for example, because it's going to feed into a problem that's already there. What we want to do is teach those muscles to regain their length and pliability. If we could create resistance or contraction in the muscle, you're not allowing it to learn the length and pliability that's necessary to keep that healthy. But here's the kicker. In keeping that pliability of muscle, in her example, it is the stabilizers of the spine, but we can take that to any muscle. If there's a shortening, then you can only strengthen from that shortened position of a muscle, right? You can only strengthen from this shortened position of the muscle, even if it's just a mild shortened position, even if it's a mild change. But with so that just points to the need, having pliability in the muscle allows it to have intrinsic strength already. There's intrinsic strength already in the muscle that allows it to be stronger already. You know, before we add the strength training to it, now it has a full functioning capacity. It's actually stronger and more powerful because it has its full function and capacity, full neurological function, full muscle function, full joint movement. And with all of that together, you're actually stronger. Does that make sense? And so we need the muscle pliability, the muscle tissue pliability, its ability to be soft and relaxed when it's at rest, in order for it to have full function and full strength when it's then time to use it and contract and be strong. So a muscle needs flexibility in order to be strong. When a muscle has full pliability, full flexibility, it has full function, then it can have its most amount of strength. What do you guys think? Is that hitting? Is that landing? Let me know. Let me know in the comments. Let me know you're here either live or on the replay by clicking a like or a heart. So a muscle, your body need flexibility in order to have its full strength. Thanks, you guys. In order to have its full strength, right? And in their lives, right? Because I always like to talk about the body as it relates to life, and the life as it relates to the body. So in your life, having full strength in your life. Hey, Carlos, glad to see you. Having the full strength in your life, the strength, what does that mean? Maybe it's the ability to make decisions, the hard decisions, or maybe it's the ability to be fully living your life, not somebody else's. That may require flexibility too, right? Being flexible and not rigid. It's like me, I've been doing marathon training, but I'm hitting a point where I'm like, I'm not sure that my body is ready for the time point that's set ahead out of force. So I'd rather, look beyond that and maybe do the half marathon. So being flexible in our goals, being flexible in the ideas of how it should be, being flexible in who you take yourself to be. And allowing that person to change and develop and grow requires flexibility in your mind, flexibility in your way of being. And that's great, and that's okay. I was more rigid for a very long time. I did a lot of hard things. I worked out hard. I did a lot of exercise. I focused on that. I focused on school. I learned about the body. I did all these things. And the focus is a good thing, and it also makes you narrow and potentially makes you rigid. Just like in the body, doing a lot of repetitive running and repetitive things over and over and over again is great, can take you a certain distance in that endeavor, but at what cost? What about all the other things that broaden you into who you can be fully, your full potential, your pure potentiality of all the things that you're capable of doing in a balanced way that maybe, you know, doesn't set you up for injury and then having to stop doing that and be crushed by it because that's the thing that you do. I'm not saying there's anything bad or wrong with that. I'm just saying having strength without flexibility may limit you. Similarly, having flexibility without the strength may limit you too. Oh, Dan, good question. How does built up connective tissue and fascia go with flexibility? I'm not quite, hey Lori, great to see you. Quite sure what you mean by built up connective tissue. To me, that sounds like scar tissue, which has instead of tissue being more parallel, scar tissue overlays in a messier way, and which is why it doesn't change as easily, but needs more like soft tissue mobilization to get it to change. Fascia is integrated with the muscle itself, so it's kind of like the overlay, like the saran wrap over muscle. And I personally like to not disconnect it too much from the other soft tissues because it's all kind of together, but it can, in my understanding, have an impact in its you know, it's a hydrated sort of tissue, so we need it to be hydrated and watery, and in that just makes me think of flexibility. And when it becomes dehydrated or more stuck, then it creates a lack of flexibility and a lack of strength, right? So it can limit our motion and our range of motion and our pliability of tissue. But the nerves also come in there too, because nerves control fascia as well. So if there's any dysfunction or disconnection or pressure on a nerve, which can come from muscle or fascia, then we have a lack of function there. So I tend to think of strength like function. We have full strength when we have full functional capacity, which allows us to be efficient and have everything working well. Like last week I was talking about the power of your posture, and so many things integrate together, right? When we stand up taller and have more posture and ability to move, we have more ability to breathe and be upright, and it also affects our emotional state with confidence and feelings of power, right? So similarly, strength can include the ability for your tissues to function properly, the nerves, the muscle, the connective tissue, the fascia, how they attach to joints, how it all works together as a system of systems. And that allows for, I think, a truer maybe concept of strength, right? Which again, I like to bring in this, includes that flexibility of things to change and be fluid and move, and you can respond to it. Because in our lives, isn't that a truer sense of flexibility? The ability to respond to what's happening in real time. So in your body, if you're running or you're working out or whatever it is you're doing, if you can respond more quickly, like another sports player, like a tennis player, but respond to your body and how it feels. Like for us endurance athletes, it's all repetitive, but if you can respond to how your body feels, you might be able to change that little posture, that little stroke, or that one mild way that you move for the better. Hey, Scott, great to see you. So strength and flexibility go together in this way, in your body and in your life. And backing up for a second, I'm wondering if I fully talked about that patient example where you just saw, where she was confusing strength as in muscle. She was confusing muscle contraction with muscle relaxation. I think we do this a lot. We can do this a lot. Western medicine maybe does this a lot, or we maybe get it muddied up a little bit, where muscle contraction is different from muscle relaxation. It wasn't until later, until I specialized in neuromuscular methods, that it became clear to me, and in working out with all these patients and the way that it helps them, our muscles also need not just strength, but also resting length. Angela, you made it, hey! So muscles need not just strength, but also resting length. And that's different from contracting and shortening, which is concentric exercise, and contraction and lengthening, which is eccentric exercise, and contracting and holding, which is isometric exercise. It's all exercise. It's all contraction. But what about your muscles being able to relax and lengthen? Muscles need to be able to relax and lengthen too, and they lose that ability if we don't keep educating it to do so. So a lot of what I give my patients is a certain type of stretching that feels way more comfortable than how most of us learn to stretch, because you're stretching to where you don't feel the resistance. But if we create resistance when we stretch, it's like strengthening. Got it? You with me? If we create resistance with a stretch where you go to where you feel it, or as our textbooks always said, to a point of mild discomfort, then you're actually creating resistance, which is a lot more like strengthening or exercise than the lengthening. And then we're always trying to balance out exercise and the rigidity of muscle that occurs from exercise or strengthening or running or swimming or whatever it is with exercise, because you're creating resistance. You've got to back off and be more relaxed. It's like kind of like that balancing act of work and rest. Strength and relaxed resting length. Contraction versus relaxed resting length of a muscle. Strength and flexibility. They're different and they integrate. Still with me? I love paradoxes. I don't know if you guys know this already. Truths tend to be paradoxical. So we have both strength and flexibility. They're two different things. Sometimes I call flexibility pliability of tissue, because it has that, tissue needs to be pliable. It needs to be soft and squishy at rest. And when it's contracting and strengthening, it needs to be, harder and what we think of when we think of strength. More supportive, more dense. Tissue becomes denser when you strengthen, right? When you contract it. We need both. If we only contract muscle all the time, it gets stiff and tight, or all muscles cross joints, so it creates tightness in the joints. Then we have biomechanical disruptions. This all goes together. And now at this point, I'm not sure if I've digressed, because so that kind of to the main point. Strength is and incorporates, how did I say it? Strength, what's the word? You guys can help me. Strength requires or incorporates flexibility. What's the word? It has within it, flexibility. Without the flexibility of a muscle, you can only strengthen so far. I have to lose a layer here. I got back from the clinic and my place is always hot because it's summer here in Boulder and it's been sunny and warm. So without that strength, without that pliability, right, of tissue, of muscle tissue, you can only get so far with strengthening. Does that make sense? Like if it's more rigid from repetitive strengthening or from tightness or from sitting, which shortens and tightens muscle too, especially the muscles on the anterior side, the front side of your lumbar spine and hips, because they shorten when you sit. And you go to ask a lot of them if you walk or run or hike or even bike or move around. And then if they're already tight and rigid, then you're wind up with some potential restrictions because you haven't done anything to lengthen them back out. So strength incorporates flexibility. Strength needs flexibility, and your muscles need to have flexibility and pliability in order to have its full capacity of strength. For my other science nerds out there and PT friends, that means we need, in order to have an optimal length-tension relationship, or even the full length-tension relationship of a muscle, we need to have that full pliability and flexibility available so that your muscle can function fully. And then in life, right? In order to function fully, in order to have, the full potential of your ability to live it doesn't mean going all the time, and it doesn't mean checking out. It doesn't mean any one thing. It's like having everything functioning efficiently, fully, full capacity. We need to have not just strength and like a, maybe we could, in our lives, we can call that motivation or drive or heart, but also the flexibility to adapt and change and grow and develop and move and get new information and with that information change our minds sometimes. Or one of my favorite books from long ago in my studies was called Aging Well, and talked about how people who aged well, what they did, and so many of them reinvented themselves along the course of their lives. So the ability to reinvent yourself takes some degree of flexibility, right? It probably takes some degree of strength as well. I think that's all I got for you guys tonight. You'll have to let me know what comments or questions you have, what came to mind, what that stirred up. If there's like, what are you talking about, Laura? Let me know. I'd love to hear it. What issues in your body that you're struggling with? Maybe it is a strength issue or a flexibility issue. What I see a lot of the time with my patients is, and oftentimes they've gotten a lot of help already, or they've been instructed to strengthen something, but the problem isn't necessarily a problem that would be solved by strengthening. Sometimes it's a problem that would be solved by getting more pliability or function in the tissue itself. And then when you go to strengthen, you have everything you need. Your muscle's already stronger because now it's not operating from this rigid place. So in your body, in your life, where are you feeling strong, and where do you have your full flexibility? And in what ways does that allow you to have full capacity, full efficiency, full strength, flexibility, power, both in your body and everything you want to be able to do with it? Whether that's, taking care of your grandchildren, being able to bend over to garden, or running 100-mile races in the, I'm trying to think where my patient like the Highlands, or I don't know, she just does these awesome long trail things like Dan does. You do that stuff too. So that's great. So where in your life do you have full strength? Where in your life do you have full flexibility? Where do they integrate and intersect? And can you see how one incorporates the other? And they're not necessarily either or. It's not quite, and what I mean by that, it's not quite like I need to work on my strength or I need to work on my flexibility. It's more like we need to have a balance of both, and they feed into each other. If you always work on strength training, then working on flexibility, pliability of your muscle in the most relaxed way actually might be what's needed to solve whatever problem you might be experiencing, if you are. Or the way to balance your body that much more. Balance out the tensions, or Dan's got 1,000 questions. Awesome, I love it. Post them in here. It took me a while to learn that. I had to kind of reframe my brain. This is all in my specializing after my doctorate. And so but what I have found both personally and professionally with all my patients is when we incorporate that resting length training, elongating muscles. Think about that. Talked last week about power and posture. It's not that hard. It's just knowing what's going on, knowing where to look, and incorporating sometimes the simplest of things. It's not always as hard or as complicated as we tend to make it in our culture. Certainly with my education, it's like a complicated things, but when it comes down to it, some of the most essential things we need to do to keep our bodies most healthy, to keep our minds most healthy, to keep our hearts most engaged and in the picture are the simplest things. So thank you so much for joining, either live or on the replay. Please let me know if you've been here. I love that you're watching and that you're interested. Please let me know what questions or comments come up. And as you go throughout the week, just pay attention to maybe first your own thoughts or beliefs around strength and flexibility, and how you might be maybe stronger or more flexible even in those ideas. All right, take care. and have a great week. I'll see you next Monday for another episode of SuperSoul Boulder, where we talk about mind, body, heart, health, and wellness. Take care. I'm your host, Dr. Lara Johnson from Yellow Brick Physical Therapy in Boulder, Colorado. Let me know what questions you have or how I can help. See you later. Bye.